Hello, welcome friends one more time on my YouTube channel Dr.Nilesh Advice. I was out from the video for a longer time because of the various reason. Now maybe I will again restart my YouTube channel and aiming for the educating the mamas and papas for their children's health. Today's topic is a very interesting topic, influenza vaccine. I know that people has lot of questions about the influenza vaccine, and one by one today I will try to clear it out. Before I will go to the main topic, let me tell you something, that this channel is mainly for the education purpose. Any specific personal advice you have to seek from your doctor. No intention of any monetizations or any kind of the profit from the YouTube channel, and whatever profit is coming from the YouTube I am distributing to the children of the needy people from the various countries. Okay, let's move to the our topic about the influenza vaccine. So first of all, let me talk you about what is influenza, or commonly known as a flu, respiratory flu. The common signs and symptoms are mainly like the running nose, cough, high grade fever. So influenza is basically one type of the virus. It is a small virus which transfers through your respiratory system. So like the people are now aware about the COVID or the coronavirus, so it is a similar type of the virus because it spreads by the air. So somebody who is infected with the influenza virus, he sneeze, he cough, and he will spread the viruses in the environment. Whoever comes in the contact or who will inhale that viruses, based on that person's immunity, he will get the infections. So influenza is one type of the very rapidly spreading the infections among the children. Why in the children? Because children generally goes to the school, they sits in a smaller areas, they are in the contact with the many people including their friends, students, they go to the park, play areas, beach areas, so their contact time is much more. So that's how they are getting more infected because of the influenza. So commonly we are knowing this influenza as a seasonal flu or the seasonal respiratory viral infections. So most of the southern globe, like the below the equator in the southern countries or the Southeast Asia, the season of the influenza infection starts mainly from the September to March. So every year there is a peak of the influenza infection after the September month, and by March, once the summer will set, then the influenza cases are started going down. So that's why influenza vaccine we introduce before the influenza season starts. So you also might have noted that every year the new vaccine comes in the August or the September, and physicians or the pediatricians target to administer those vaccine at least before the season starts, so that children doesn't suffer, children don't get the infection, and then we start the vaccination. So on an average we also communicate with the common people for the vaccination drive, so that you come and take the vaccination. Now many people has the question that it is not in the mandatory schedule, then why we should take the vaccine. So what I want to inform you, so the vaccinations which is mandatory and non-mandatory is based on mainly by the government, because the mandatory vaccinations are funded by the government. So it depends on the financial situation of the country. Like in some countries you will see lot of vaccines which are in the mandatory schedule, while in some countries there are very few vaccines which are in their mandatory schedule. So if I will put it like that, it is mandatory or non-mandatory for the government, not for your child. Your child needs protections, so the vaccinations give you the protections. There are people who says or who discuss with me that we learn that if we let the child exposed to the influenza, he will develop automatic immunity, but that is not true, and again it is a risky. Like the influenza infection, specifically in the smaller children, like the less than 5 year of children, it can goes in a different direction. It can show the various complications. It can cause pneumonia. It will start a faster breathing. It will require hospitalizations. It will require oxygenation, and we have reported the cases where the children requires a ventilatory support, means he cannot breathe well. So it's risky. Less than 5 of the children for the influenza is in the quite a risk category age group. So we don't let that, yeah, let's expose the child and get the infection and let him develop the immunity. And now again, the influenza virus is such a virus, it changes its shape every year. That's why there is a every year vaccination. So you might have seen in the COVID how there are different variations or the variants used to come into the market. So the same way the influenza also have a lot of variations. So if you will broadly classify, like influenza type A, type B are the most common viruses which is causing the infections, and amongst them influenza A is a quite severe infection. Commonly we are knowing it as a swine flu. So if you are aware that few years ago, like around 2009 or 2010, there was epidemic of the swine flu. Not epidemic, it is a pandemic. So a lot of people had died because of the swine flu. So influenza A is a bit severe variety, influenza B is a lesser variety. Now people also argue that even if we will catch the influenza, it is a very short lasting, maybe in 4 or 5 days we take some medication, we take rest and we will start getting better. Then why the vaccinations? Again the answer is same. You don't know that how the infection goes ahead, how much complication you develop, how much is your immunity to fight with them. And when you are going to the doctor, this all matters, and it is a risk. It is a risk of to play with the fire. So I strongly recommend influenza vaccine to at least to the high risk individuals, like mainly the children of less than 5 years of age, infant, pregnant mothers. Then specifically the children who has a frequency of the wheezing, they get a lot of wheezing, wheezing by any infections or without infections, asthma, or they are on some longer medications, or they have like some illnesses which is related with their heart or with their lungs. So I strongly recommend at least to those people to take the influenza vaccine. To make you more confident of the vaccination, I must tell you that I take every year the influenza vaccine, and even I am giving to my family also every year influenza vaccine. So that's how I trust the influenza vaccine. It's upon you how much you trust on the vaccine, how much you trust on your doctor, and how much you trust on the flu infection, because the flu infection is a risky infection. So that's what's the background about the influenza virus and the disease of the influenza or the flu. Now, if we discuss something about the influenza vaccine per se, influenza vaccine comes into the August or September, and we will start administering it. But you have to remember that the countries who are above the equator has the northern hemisphere vaccine. The countries below the equator, they have the southern hemisphere vaccine. So both the vaccines are different. Now let me tell you how the vaccine comes in the market. So there are governmental bodies like the CDC or the WHO. They monitor the influenza viral infections throughout the globe very precisely. They track those infections even weekly basis, and based on that they will come to a point that they will predict that year 2014, 2024, 25, this type of the influenza virus will be more prevalent, and based on that they will start rolling out a vaccine. So influenza vaccine is very closely tracked throughout the globe, and based on that influenza vaccine is getting produced. Many times it happened in the past that what was predicted by the CDC or the WHO, but there is a different strain which is in the circulation and the vaccine is not that much effective. Yes, it happens, but we cannot take that chance that we catch the infection and face the complication of the influenza just with that chance. So far, if we consider the effectivity of the influenza vaccine is not too high, but it is a significant, like it is more than around 58 to 70%. So that means like if I am giving the vaccine to the 100 children, 70% means 70 children are protected. 30 children might not be get protected. So that's based on how the medication efficacy or the vaccine efficacy work. Now, how we administer the vaccine. So this is a basically injectable vaccine. So it is given into the muscles. So in the small children, we prefer this vaccine to give to the thigh, because that is the safest area to give any intramuscular injections. That means the vaccine to be given into the muscles, so intramuscular injection. So the thigh is the safest area. So we generally give the vaccine to the thigh in the children. But in the adults, you can take over the arm also, like the deltoid muscle are a good strong muscle where you can take the vaccine. Now, how many doses of the vaccines are needed? So if you will look at the schedule, like if your child is less than 9 years of age, then you will need the 2 doses of the vaccine first time. So when you are giving the first time this vaccine, you have to take the 2 doses of the vaccine with the gap of 1 month in between, if your child is less than 9 years. If your child is more than 9 years, then only 1 dose is required. Suppose your child is less than 9 years and the previous season you have taken a 2 dose, then this year only 1 dose is required. So less than 9 year children, if you have taken any time the 2 dose, only 1 dose, that's all, finish. More than 9 year children, 1 dose, that's finished. So no more doses for that. Now people ask a lot of things about the side effect of the vaccines. I will tell you, I am giving the influenza vaccine for maybe last 15 years. So overall, not a great side effect I have observed in the children. It is very well tolerated vaccine, very safe vaccine. Yeah, but some children develop the high grade fever. Some children may develop the pain where we are injecting. Some children may develop the leg pain, which is one of the common symptom. Very less children, or very remotely in the textbook it is mentioned that some illness known as a Guillain-Barré syndrome can happen. But so far I am yet to see any patient who developed that adverse reaction or the side effect of that vaccine. So very well tolerated vaccine. Now let's talk something about the children or the people who should not take this vaccine. Number one, if you have a severe egg allergy, if you have just mild skin rash of the egg, or just little bit amount of the sneezing after the eggs, or maybe the vomiting after the eggs, that is not a contraindication. Severe egg allergy, that means if you have developed the faster breathing, violent cough, or your blood pressure goes down, then that is known as anaphylaxis because of the egg protein. Those children or those people should not take the vaccine, but they can take the vaccine in the hospital setting. So suppose you are going to the hospital where all the other facilities are available, like suppose if you develop that kind of the severe reaction, if they are able to manage that, then you can take that vaccine. Second thing is like any component of the vaccines, if you have a reaction in the past, then you should not take the vaccine. In the past, if you have suffered from the Guillain-Barré disease, it is a one type of the disease where children get the paralysis of their muscles, then you should not take that vaccine. Or there are certain medications which cause the disturbance in the uptake of these vaccines, like the steroid medications or the immunoglobulin medication. Then you have to discuss that with your doctor, and then you have to take those vaccine. So overall, there is not too many strong contraindication where you should not take. Who should take the vaccine? The number one, the children less than 5 years, the children who has the chronic illnesses or like the specific illnesses like the asthma, heart disease, cancer, they must have to take, but discussion with the doctor. Pregnant ladies, it's highly recommended. Pregnant ladies should take, because the risk of the side effect of the influenza is much more in the pregnancy, so they have to take, and it will partially protect their newborn also. And suppose you have the newborn and you get the influenza, then the chances both of you catch the influenza infections, and the influenza infection in the newborn is quite severe. Quite severe means it requires a hospitalizations, oxygen support, and something like that. Specifically, influenza infection is the virus which spreads into the winter, and in the winter is also favored by so many other viruses. If you have heard the name like the RSV virus, respiratory syncytial virus, COVID virus, adenovirus, parainfluenza viruses, all these viruses are quite common in the winter age group, in the winter season. So at least we can protect our children from the influenza at least. There is one question which many patients ask, that doctor, we took the vaccine but still we get the influenza. It's possible. It's possible. That's what I told previously, that the efficacy of the vaccine is 70 to 80%. So if you are in that 20% who are not protected, they might get the influenza infection. But again, if you are vaccinated, even if you will catch the influenza, your symptoms will be less, your hospitalization rate is less likely, and you are getting the faster breathing or the oxygenation is less likely. So either way, the influenza vaccine is beneficial. Now there are some parents find the shortcuts. They don't want to go to the doctor, they go to the some pharmacy to take the vaccine, they go to some local healthcare provider which give them the vaccine at home. This is a risky game. Why it is risky game? Like the vaccine is basically biological product. So whenever you are introducing the biological product into the body, there are chances that body doesn't accept it or body react it. Though this is a safe vaccine, but there are chances that body might react to it, and that reaction, if it becomes like the anaphylactic reaction or the severe allergic reaction, then it requires a very immediate care. It requires a certain kind of the medications like the adrenaline, cortisone, oxygen support, and those things. So to administer the vaccine in the pharmacies or at home is very, very risky, and I will not advise to take that chance to the smaller children. At least bigger or the adults, maybe based on your risk profile you can take that chance, but for the children's I would not advise. Now as the influenza vaccine comes every year, and every year it shows the various like the updation in the influenza vaccine, you have to get administered the influenza vaccine every year. In certain countries there is a different type of the influenza vaccine which is known as a live vaccine is also available. That is by the nasal spray, just like the how we use the saline nasal spray, the same way the nasal spray can be used. But most of the countries the injectable vaccines are available. Live vaccine, the nasal vaccines are not that frequently available. So if it's available in your country, yes, you can take the live vaccine. That will be helpful to you. What else? Like the most of the things which parents has the questions I have answered. If you still have any queries, any questions, you can put into the comment box. I will answer as early as possible. And yeah, that's all about the influenza vaccine, influenza infections. And I strongly recommend, as I told you, to get the influenza vaccination done. Thank you very much.